Good evening, everyone. Welcome to a CARE webinar series where we talk about issues that are related to arts education and research. And sometimes we will find topics that are quite unusually located in arts, research, and education. And that is exactly what this evening will provide for.
Good evening. Welcome everyone to a session in which I am engaged in a conversation with Dr. Chia Wei Khuan, former head of VPA, well-respected McCloskey voice care musician and physician, technician, and still a welcome part-time colleague of ours. The title of this talk is Voice Unfolded. For those of you who are familiar with my slashes, you know that right in the middle of all of this is voice and fold. And whether you want to call it the vocal fold or the vocal cord is entirely up to you. But I'm more concerned with, and both Dr. Chia and I are more concerned with possibilities and prospects and problems of injury and well-being in singing. Let me make this very clear. Our views expressed in this presentation are ours only. They do not represent the views of an or any institution. And this session focuses on the voice and seeks to initiate a conversation on causes of possible injury, potential injury, in order for us to understand what cautionary approaches can be made and advice to and for early learners, whether you are early in your chronological age or you're early in your later stages, to both the singing voice and the spoken voice, since they affect both aspects of it. Before I continue, I want to thank a number of people. I want to thank Melia from the NIE Libris, who enabled me to search for archival data. I'm very grateful to her support and her help in getting to that data. I'm very grateful to the CARE team, Zul and Anthea, who've helped us get some of these issues put together to enable us to look at these issues which are there. Dr. Chia, I wanted to begin literally on our present, since there have been enough articles in the Wall Street Journal and many other journals on Adele's doctor and talking about vocal cord hemorrhage and John Mayer having to go through surgery. And they are just two of a number of professional musicians in the popular music trade who have actually suffered injury to their voice. And I guess if they were doing this as a livelihood, this is financially devastating. This is physiologically devastating. In terms of well-being, I can hardly imagine these performers not being affected by such injury to their livelihoods.
Okay.
What would you say to that?
Okay, first, I must thank you for the very nice introduction of what I'm doing. All right. Actually, maybe I talk about myself a little bit. See, actually, I only trained as a singer. But later on, when I started my work in NIE in the 80s, I have several colleagues say, hey, I have students, okay, after 2 weeks or 3 weeks of teaching practicum, they have no voice. They can't speak anymore. Can I refer them to you for some kind of sort of like training or help? So I started looking into some of the so-called problematic voice as a trained singer. Back then, I didn't know anything about this voice disorder. All right. However, I try to utilize whatever I know about training the singing voice to help those speakers, voice users. Unfortunately, I think some of the exercises did work. So that inspired my interest into looking into voice care, vocal health.
You know, it's very interesting that you say that, Dr. Chia, because it seems to me that we tend to think of the singing voice as the only voice. We speak of the speech voice as another factor. But I remember this because you did guest lectures on my music and acoustic lectures on the voice.
Yes, sometimes
And
ago.
of course, it was some time ago. But you actually drew on a physiological phenomena called phonation. And sometimes phonation seems to get missed out because between the singing voice and the spoken voice is the way in which the vocal folds or the vocal cords become the aspect of phonation. Could you take us through that?
Well, actually, there are a lot of parallels between the speaking voice and the singing voice, right? So in terms of the so-called fundamentals of how we produce the speaking and singing voice, more or less they are the same, except that if I may just use a very simple statement to distinguish what is a spoken line and what is a sung line. See, singing is elongated speech on pitch. Actually, this is a statement. The meaning
Right.
is coined by the McCloskey. But there are also other people saying, even the Italians said, sing the way you speak. Of course, strictly speaking, one may not sing the way we speak, or one may not speak the way we sing. But there are certain overlapping principles for the singing voice and the speaking voice. Now back to perhaps your question about, okay, some of the professional singers, actually not just pop singers. I think classical singers, or we make classical, non-classical, okay, we just generalize them, okay, into two groups, easier to discuss. Actually, all voice users or singers, they are prone to voice disorder or voice injury. You know why?
How does that take place?
See, the way we produce a sound, or we phonate, okay, phonate means we activate the breath to activate the vocal folds into a kind of vibration mode. All right?
So this phonation begins, I recall you saying it coming from the pelvic floor, which medical practitioners may probably understand to some extent, but I think most singers would think, when singers say, please sing from...
Well, again, there are not just one school of thought on singing. There are, and not two, there are
Many.
many. I remember reading something like, okay, when we inhale, all right, usually I don't say when we breathe, okay, when we inhale for singing or for the purpose of phonation, all right. I remember reading there's one pedagogy saying we must not just lower our diaphragm, we must also sense we can simultaneously lower the pelvic floor. Some people say, okay, we have two diaphragms. One is the our diaphragm between that divide our chest and the stomach. All right. The other one is much lower. Okay, we call it. Some people call it pelvic diaphragm. Some people call it pelvic floor. There's one pedagogy. Okay, we have to simultaneously lower both diaphragms in order to get a full inhalation, or you can inhale in the way that is required for singer. However, definitely there's other thoughts about sensing the pelvic floor in action when we inhale. Right. See, for example, if we subscribe to the so-called Italian term of breath management in singing, they use the term appoggio. Basically, they only talk about lowering the diaphragm rather than at the same time activating the pelvic floor
Right.
during the inhalation.
Right.
Okay.
And-
So it's a very controversial thing. So depending which pedagogy you are more inclined to subscribe and you think is more practical.
You raise some very interesting issues in here, Dr. Chia, because I know I began with the professional singers,
Yeah.
those for whom the profession actually is something that is financially potentially devastating to them.
Yes.
I'm just wondering to myself, by the time they get there, the habits that you talk about seem to have become so well ingrained. You know, it's like a professional athlete who doesn't really care about their hamstring until it really hurts them. And the concern here, of course, is by the time they get to the level of the professional trade, it's all about corrective medicine and corrective surgery.
Correct.
You use the word pedagogy, which I find very instructive, because then the pedagogy demands that there's a pedagogy that is clearly needed at the level of the professional trade, but really at the 5-year-old who wants to become the next professional singer. You know, how would you manage those concerns, Dr. Chia?
Well, in my view, teaching of young singers or teenagers or young adult or even more matured adult, okay. In general, we adhere to the general good fundamental of singing. So whether we are teaching a 5 years old or maybe a more advanced student or even semi-professional in the late 20s, even sometimes as late as early 30s. In general, we have to adhere to the general principle in my teaching, and I think this is also advocated by many sound pedagogies. We usually look into at least a good posture. All right, if we are standing, we have to find a good balanced posture. All right, and if you are sitting, we have to find a good sitting posture. In the standing posture, basically, if you have no time to think of different parts of the body, how they complement each other or how they balance each other, you just think of, I always tell my student, it's not a joke, but I said, just stand tall and unlock your knees. And this is, again, a view shared by Jessie Norman when she was interviewed by someone. Oh, I remember my mom told me, stand tall and sing. Okay.
She could have said stand tall and stand proud.
Okay. So that's the standing posture. Basically, we just stand tall, transfer all the weight to both feet, unlock the knees. I think that because we have no time, if you want to go on stage and sing, when you start examining, okay, whether I should unlock my knees, I should tuck in my pelvic or tailbone, or it's too late to complete the arias or the songs.
Correct.
Okay.
That's
Of
true.
course, sitting is the same. Sitting, I will just advise my student, transfer all your body weight, the upper body weight, to your sit bones. That's at the bottom of your pelvic. Okay. So whether it's a young singer, more adult singers, so the posture is next. Breathing. I think every one of us knows how to breathe. If we don't know how to breathe, or we don't breathe, I think we are lifeless. Okay, so we all know how to breathe to some extent. Of course, the breathing for singing is slightly different from our daily routine breathing. We got to learn how to delay the outgoing breath. That's, I think, the key word, delay. Of course, how to delay the outgoing breath for the purpose of phonation, of vibrating the vocal folds to produce that signal, it may vary from person to person. Okay, even two different, and then whether the teacher can really identify the person is disseminating the breath or emitting the breath in the more preferred way, also depending on the experience and teaching of the teacher. So that's the second aspect. Of course, and I often go down the scale. The next one, probably we got to look at, got to learn how to, singing, that's again slightly different from our normal breathing. We got to learn how to expand our ribs, the rib cage to a certain extent. So we got to train our intercostal muscle, that means the muscle between the ribs, to lift that rib cage, to let it expand throughout the process. However, there are some pedagogues when we say, okay, I subscribe to lifting, expanding the rib cage. So they advise the student or the instructor, okay, use most physical strength to push it out. And then you sound like this, all right? Then the voice can be a little tense due to over-exerting certain body parts.
You see, Dr. Chia, one of the things that emerges out of this, of course, is if you're a speaker, that's one aspect of it.
Yeah.
If you're a singer, then the focus, the priority of focus is the pitching.
Correct.
You know, and you've given me an interesting perspective on how much of the body we use or misuse or abuse when we are singing, because the outcome might be get this A equals 442 hertz and pitch this aria the way it should be. Pitch, 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 pitch. And somehow the body seems to be a casualty of that process.
Okay, then I think we have to look into how we can find a more balanced usage of the body during the process of singing.
Body or voice, Dr. Chia?
Well, actually, unfortunately, the voice is part of the body. That's why in my vocal hygiene and vocal health component, when I share my students, I often, fortunate or unfortunate, we have to deal with, the voice is part of the body, all right? And of course, I also joke with them, and I'm quite serious about it. See, if you don't like a piano, if you are rich enough, you can buy a Bösendorfer or Steinway or whatever, good piano. Okay, you can discard your not so preferred one. If you have money, you can buy the best violin to play. All right. However, you cannot buy the best voice and transplant it into your body. All right. Probably it can be done in the foreseeing future. I don't know. But at least for now, if you want to enhance your voice, you got to appreciate its value by learning how to do it appropriately.
So there's a symbiotic relationship between the voice and the body.
So to me, and according to my learning from the McCloskey method, you see, every voice, if you have a problem voice, can be cured, can be treated. Same thing, if your voice has no problem, you can enhance it. Of course, when you enhance it, you add value to that, the voice. However, I also inform my student, if you can enhance your voice, that's only one aspect or one component of the holistic voice. To be a good singer, or whether you want to be a classical singer or non-classical singer, you still need musicianship. That is another part of learning. Of course, in my 2 courses I taught in NIE, I said I only teach you the voice component. I haven't had that kind of opportunity to incorporate a lot of the musicianship part. I hope I could, but in this course, I can only rely on your existing musicianship, pitching skill, okay, plus other like rhythmic skill, to see whether you can incorporate into your singing voice.
Right.
All right. So this is how we see a single. So in order to find the kind of total balance, and many singing teachers use the word equilibrium, because we don't treat the voice just solely okay, looking at the voice itself. See, the voice, depending on the breath, which you see, or maybe just there are 4 basic components. Okay. However, these 4 components can be independent components.
What are
First,
these 4 components?
yeah. So the voice is the one component.
Right.
Now, the breath. Of course, I often use my hand to place or show them, okay, the breath. Actually, we don't breathe that low, but we are using the stomach muscle to manage the breath. So, of course, the breath, we still fill up the lungs with breath, but we manage the breath using our more elastic stomach muscle. So, the breath is the second component. The third component, okay, is the resonance. The resonance, mainly there are 2 cavities, 2 major cavities that we use to enhance, amplify the voice. The 2 cavities are the oral cavity and the pharyngeal space. All right, and very often, singing teachers call the pharyngeal space the singer's throat. Okay. Then maybe I go on to the 4th component. The 4th component is the articulators. All right. So actually, when we hear a final product, actually it's the breath, sound source, resonance, and articulation. All right. If we take away the articulators, then actually we only have nonsensical sound like a, e, o, u. It doesn't. If it doesn't change up to represent any meaning, then actually it's just a nonsensical sound. When you say, how are you today? Say, how. You say, H and how. Ah, you today. Then we understand, oh, this is the English statement, how are you today? So these are the 4 components that everybody know how to use. However, how well we integrate these 4 or gel them into one, that's another story. For example, if we experience, for example, like the singer's throat, the pharyngeal space, these are part of the swallowing and constricting muscle. If we don't know how to relax those muscles and let the space remain loosely open, then we are compromising one of the most important resonators. Okay, then the vowel may not be well defined because I think linguists, phoneticians, or voice scientists, and then good singing teachers, they all know the way we define vowels are depending on we call 2 peaks of that overtones. Okay, we call formant 1, formant 2. So actually, all vowels are defined by different mixture of the formant 1 and 2. And in singing, why we need to relax and loosen up the pharyngeal muscle, because we want to have more unified formant 1 in the singer's throat. Of course, we leave the lips, tongue, jaw to adjust accordingly in order to gain that different formant 2. Then we hear different vowels.
Right.
Yeah. But although we can relax the pharyngeal space to get formant 1, however, if our lips, tongue, jaw are still rigid and tense, so it may affect the overall production. So that's why just now I mentioned 3 to 4 fundamental. So the next that follows, say lips, tongue, jaw, we must learn how to free them up and relax them. Of course, adding to that, we must also learn how to lower or stabilize the larynx and raise the soft palate, because that will ensure us we have a good ceiling and a good floor, okay, for that open singer's throat.
So in a sense, if I were to put it crudely, your voice now becomes a resonating chamber.
Yes, to some extent, yes,
Okay.
that's true.
Okay.
It's acoustic instrument.
Sure. I wanted to take you through that holistic voice that you spoke about because you, of all people, have done Cantonese opera. You've worked with the Xiongling Musical Association, with the Hokkien tradition. You've worked with the Chinese orchestra, which would mean, and you're familiar with the Japanese traditions of kabuki and no. Whereas someone might think, well, I'm training the voice, I'm only headed in one direction, which is musical theater. If not, it's benchmark examinations and stuff like that. It's very interesting that when you talk about the holistic voice, that you're also alluding to cultural domains and culturally specific practices, which may demand a very different kind of demand on the voice.
Yeah, okay, initially, I was quite ignorant of all this variety of style and voice usage and their voice application. Of course, it's over the years, after working with some for example, I have sometimes, not that I want to teach someone who is singing Chinese opera or, like for example, Cantonese opera, but someone said, oh, I think, when I went for my rehearsal, my teacher or my mentor just keep asking me, okay, I sang it once, repeat it second time, third time, fourth time. Dr. Chia, my voice is very hoarse after singing 2 or 3 times.
Of course.
All right. So I said, something must be wrong. Then I also had a student, actually he sang also Indian music. The Indian music guru kept asking him to repeat, do it one more time. So I asked him, did your teacher ask you to make some adjustment or improvement after the first attempt? No, he just simply asked me. See, my Cantonese opera teacher did the same. My Indian music teacher also did the same. Okay, I said, all right. So I listened to the voice. To me, in general, whether we are singing, some people said, certain genre, we are using a kind of reinforced, falsetto, all right? Or reinforced male falsetto. Some may say, we are using the real voice, right? And some may say, okay, we have to use our chest voice, our mixed voice, in the mixed voice, some people call it the medium register, then the upper register or the head voice. So actually this kind of terminology can be very confusing as well.
Yes.
But I disregard all this terminology, but I just listen to the voice. I go for healthy voice production.
That would make it diagnostic,
Correct.
which would lead you to formative towards summative discourse.
That's where I learned it from, the McCloskey method. Actually, before I went for the McCloskey voice method, I thought there's no such thing as you can sing naturally, or there's a natural way of singing. Of course, again, it depends on how we define the term natural. Of course, singing is, you can call it, okay, when you sing it well, you can see the lips, tongue, jaw, and the whole body, they just gel into one. So naturally, you say, oh, the voice is sounding so natural. But actually, in order to look so natural or sound so natural, actually, there has to be a lot of work behind the scene. We got to find the right place, or the lip, jaw, tongue must go to its, or they must go to their right position during the act of singing. Of course, the stomach muscle must have enough elasticity to disseminate or distribute the breath to produce the kind of vibration at the glottal level.
Right.
Again, we also have to know how to adjust the the singer's throat, even the oral space to conform to the need of good singing.
How early does that begin, Dr. Chia? I mean, it sounds to me like the moment you begin your singing lessons, the things that you speak of, idealized or idealized,
Oh.
you're suggesting that there are certain habits that need to happen, but you also need the habitat of the pedagogue to be able to watch their learners take through that process.
Definitely, it takes many years of accumulation of all this knowledge from very little to a lot more. I won't say I have reached my max yet. I think I still have a lot more to learn. I'm still reading, although I don't have a chance to go to that master teacher or the kind of mentor to learn more about the singing, but I think it's over many years of accumulation. In fact, sometimes I told my student, you know, if I were to teach you much earlier, probably I won't teach you something I practiced in my earlier days. I already disband or abandoned that because, you see, based upon my current understanding of it, so I avoid doing something that I did before. Okay, I'm not saying that I'm doing it totally wrong, but see, as most singing teacher actually, they are trained as a performer. Actually, not many of them are trained as singing teachers.
Right.
But somehow along the line, okay, along their career, they have to start performing and teach. Of course, in Singapore, it's not easy to be a professional performer. You may not get engagement almost like all year round. So you can perform, but on top of that, you have to teach. I'm not saying that we are not qualified to teach entirely, because many of us will teach the way how we learn about singing.
And so there's that gap between the
Yes,
practitioner
correct.
and the pedagogue,
Yeah.
right?
So I started teaching what I thought works for my voice. All right. Actually, in my work pedagogically, it could be okay working for my student as well. However, I need a lot more theoretical foundation actually to support those teaching. That's how I started to be more interested in the vocal pedagogy.
But isn't your theory informed by practice? Because it is one
Yes.
thing to read a manual
Yep.
and say, okay, do this to your pelvic floor, sing with muscles that I haven't learned since I was 4 and a baby, and then now I've got to figure this out. Whereas as you've taken that heuristic journey
Yeah.
as a
So
as a performer,
fortunately, I continue to perform. I continue to learn more about the teaching of singing and learn more about the vocal pedagogy principles of singing. So I try to combine both, okay, practice and theory. Of course, then I start noticing as my knowledge of certain vocal fundamental principle start to expand, I start to discuss something that, oh, I know, according to anatomically, maybe even in scientifically, not quite appropriate. So I try to make a choice. That's how of course, when I started the McCloskey, actually they advocate, okay, we have to release the tension of those unnecessary muscle. By the way, in singing is a bodily activity. So that means whenever we perform a bodily activity, there must be a body muscle involvement. All right.
I'm going to embarrass you now, Dr. Chia. If you would show us what you mean by the body. And we've got your two mirrors here
Okay.
to help us demonstrate what you
Yeah.
mean by bodily posture.
I may use the two mirrors to demonstrate my posture.
Okay.
I say, for example, the McCloskey exercises begins with 6 areas of relaxation. If you ask me previously, oh, we're going to sing naturally and you're going to relax. So I was asking myself before I learned the McCloskey, how can one really relax and sing? All right. Of course, now I understand. When you say relax and sing, it's not totally become very lazy and very sloppy. If we are very lazy and definitely the body is not responsive. So the so-called, the real meaning of relaxation is to find a good balance of the usage
I
of
think
the
you
muscle.
use the word equilibrium, didn't you?
Yes. So see, for example, as simple as the first, I may not go through all 6 exercises, but maybe you just use that first exercise. Facial muscle relaxation. See, you relax your facial muscle from the forehead down to the temple. Okay, I'm just doing a very quick demo here. Now, that chewing muscle, we chew, we eat and chew, drink, almost like, I won't say all the time throughout the day, but at least most of the time. The moment we're exercising this pair of strong chewing muscle. So if these two pairs of muscle, they are highly involved in singing, definitely is going to create an obstacle to the singing voice. So we got to learn how to uninvolve these two pairs of strong muscle. So this is what we have to do. Of course, we can also massage the portion above the lip.
The upper lip.
Mainly this is to relax the muscle
you did speak about the
beyond that.
primacy of the oral
I always
cavity,
call
didn't
this the
you?
lipstick lip. Okay, so we are, actually articulation required more of that lips, the area above beyond the lipstick lip than our lips themselves. Okay, so this is the meaning of. So we must find that kind of balance. Even when we have to phonate, we will onset the voice like Actually, there are intrinsic muscles activities. So we got to learn how to find the right. If we are engaging those intrinsic muscles overly, too much of that, then you hear tension. So that's overdoing. If you are under doing or engaging those, you hear leakage of air. At the same time,
It sounds like a leaky balloon, doesn't it?
yes. Okay. So in the so-called singing term, we say, okay, we avoid the breathy onset, we avoid the press onset. We want to go for that balance onset. So in the teaching, we try to teach the student to discover that balance onset. See, in fact, the monumental book written by Richard Miller, the very first chapter is onset. If you know the onset properly, probably you also influence the breath engagement, coordination. And then you can also stabilize the larynx. It has so many advantages, benefits. Okay, maybe now I go to that mirror to demonstrate a little bit of the standing posture. What do you mean by a balanced, relaxed standing posture? Basically, maybe I take off my jacket so you can see my full body view better. So for example, if I'm standing in this manner, you notice my head is assuming a forward head posture. Actually, my spinal column is not in the kind of we call noble, lengthening, erect kind of adjustment. So in a good balanced posture, we actually try to avoid, this is not relaxation. Actually, this is sloppy or some kind of sluggish, lazy standing posture. So what we have to do, in order to find a good balance, relaxed standing posture, first we transfer all our body weight to both feet. Basically, you just find a good feel of that the weight is taken over by 3 spots. I call a foot tripod. That means there are 2 front balls just behind your toes, and then the heel of each foot. Okay, so just transfer all the body weight to each foot. Then the upper body from the feet up remain just tall and straight. Next, you relax your knees. To relax the knees, actually easy. I often ask my students, lock their knees and then unlock them. That's the unlock knees. Okay. Once we are in that position, if today through this video you can't find this adjustment, that's fine. We perform a pelvic tilt. Sometimes some people call it tuck in your tailbone. Okay, so you see, if I adjust my pelvic down, forward, see, actually you notice if I don't drop my upper body, or if my upper body is not stiff, my upper body straight away assume a tall, noble stand. Actually, with this slight adjustment, one should sense the spinal column is lengthening, okay, downward, because of this down and forward rotation of the pelvic. And in fact, after this adjustment, the upper body should be in a so-called, the Italian call it appoggio, good appoggio posture, okay? If you were to, like what I said earlier on, to lift or expand the rib cage, you can actually just raise your arms to the shoulder level. Often I ask students to turn their palm facing the front. All right, so you should sense a good expanded or fanning out of the rib cage. Now lower the both arms without lowering the rib cage. Of course, if we can activate the muscle between the ribs and keep the rib cage up, then you should be in this kind of noble and tall posture. Shoulder nicely balanced on top. Don't let them roll forward or pull too far backwards. Okay, head, neck, if you can feel that, is nicely balanced on top of the spinal column, then you are assuming a nice, balanced, noble standing posture. Okay, and then you can walk away from this position, and you learn how to retain this position as much as possible.
That's very instructive, Dr. Chia, because I do wonder how many early lessons, and whether you are 55, 75 or 5 years old, that one actually gets that kind of advice at the early stages, because obviously you've taken quite a lot of trial and tribulation in terms of, okay, this didn't work for me, that didn't work for me, and then now I've got to do this. How much of that do you think needs to happen at the first lesson?
Actually, regardless of at what age one begins sing lesson or trying to learn, for example, a simple sort of like approach, like finding a good posture or finding the sitting posture. Of course, when we teach different age range, we may use different teaching strategy. Okay, if I were to teach a 5-year-old, I mean, just okay, I play with the child and then okay, maybe help the child to find a good standing posture. And sometimes you may not be always in the static standing position. You may even see on stage. Sometimes we may also have to move to different position. So actually, it's good to learn that standing posture and then to move around in that the space we
And
have.
find the equilibrium that
Correct.
you're talking about.
Yeah. So, and actually, sometimes some singers find just standing in the kind of same spot, in fact, can develop some kind of tension, undesired tension. We want that desired tension, balanced tension. So, actually, for different age range, we may the principles are the same. Okay, we got to learn how to sort of find the balance of each part of the body. All right.
Because this raises a huge number of questions in terms of someone who's got to pitch it right and someone who is at peace with their body, equilibrium as you use
Yes.
it, so that the voice and the body are working together.
Yes, that's why when I read the article you share with me, Ramazzini.
Yes.
All right, that
In
was written in the
1713, right?
So it's
And
in the 18th century, right?
yes.
Of course, I was, as I said earlier on, singing involves the body, and there are muscular activities. Definitely, he relate to a lot of bodily activities in his article.
Yes.
And also depending on, I think he mentioned about, people vomiting blood, okay? And then some people develop hernia due to singing and hemorrhage. I don't deny singing is a bodily activity. But of course, the good pedagogy may not utilize the body to that extreme.
Right.
We must find a kind of very comfortable balance, equilibrium within. Then each part of the body, each part of the singing instrument, actually they are complementing each other in the overall process. Okay.
So you're actually alluding to prehabilitative discourse in pedagogical discourse.
Yes.
Very much like our physical education pedagogues who make sure that you're sensible with warming up and getting things done together before you engage.
You're absolutely right. You see,
Okay.
I believe a sprinter, let's say a 100-meter sprinter, he or she would not go onto the field and sprint 100 meters straight away. I think the runner, the sprinter, would have to do some kind of basic toning up, stretching,
Right.
and then in fact, he or she may not sprint 100 meters even after the immediate warm-up. The person may have to gradually build up. I think that our vocal folds are quite similar. See, of course, some singers may require less time to warm up. Some may require more time. However, if the fundamentals are sound, probably one can take less time to warm up. See, that I go for. We must find that correct or the comfortable, the friendly laryngeal position. We must be able to engage the breath using the more elastic, stronger muscle. Because if we don't do that, probably we may be using high chest breathing to produce the sound, the phonate, all right, to initiate the sound. And then when the breath is a little too high, actually the tendency, because of the anchoring
Yes.
or the gravity is not low enough, so actually the larynx may raise due to our swallowing muscle is so frequent, so habitually pulling the larynx up. If our lip, jaw, tongues are tense, and some of the muscle tension may transmit to the voice box, that may upset the position of the mainly the tongue bone and then the entire voice box. So we got to work much harder to find this kind of alignment. So actually warming up means also finding this good alignment, coordination of the breath, sound source, resonance, plus the articulator. Then once it's ready, So we are ready to see. And of course, in singing high note and singing lower notes, it depends on the premises. We must make sure that the larynx is more stable. You know why? I often use these two acronyms. I say CT, TA. All my singing students, they know the moment, okay, CT, TA, because I think CT represents cricothyroid adjustment. Actually, it's that cricoid and thyroid muscle contraction that elongates the vocal folds. And then when I said TA means is letting the vocal folds, the thyroid muscle to relax or contract a bit more or shorten to get more mass. One is to, the CT is to encourage stretching and thinning out of that vocal fold muscle. So in the human voice, we cannot sing high notes like, okay, when I play the guitar or violin, I want to play the higher note, so I can just move my finger further up the fingerboard. We can't. Okay. But the instrument can. All right. However, human voice, the moment we want to sing a higher pitch, we got to learn how to elongate the vocal folds and then thin the vocal folds in order to allow the breath to vibrate it faster.
What would happen if you stretched it? I'm thinking here in
so stretching it, that's the skill. That's the muscle memory we got to develop. You can call it skill. You can call it habits, whichever you want to call it. So as a singer, that is a learned skill. We got to learn how to activate the cricoid and thyroid muscle. Actually, these are two pairs of muscle connecting the two cartilages. So we got to put in place a stable larynx first. Then that action can take place for that high notes to happen. If one is not singing with that kind of adjustment, usually we will hear a little yelling and shouty kind of voice production, which actually is quite common in so-called the non-classical music. So back to the very first thing you mentioned
yes.
this afternoon. Okay, Adele and some singers experience some kind of voice problem, all right, and hemorrhage, things like this. Yes, excessive shouting, because shouting involves large quantity of air. Plus, actually, when we shout and yell, we also engaging the vocal fold with more muscle mass. And when you have more muscle mass, that means you have an instrument that requires more energy to move, to vibrate. So that kind of impact may cause the little very fine blood vessel within that vocal fold to burst. And sometimes, of course, not necessarily if we go to a sport game or kind of setting, we yell and shout. And it can also cause the same. And sometimes it can be caused by trauma, like some kind of a knock against the wall, okay? And sometimes in an accident, it can also trigger that kind of hemorrhage. Of course, the other voice disorder, the most common one is the nodules, which is very common in just voice user. Can be a singer and non-singer, all right? And we also notice that sometimes this happens because it's excessive use of the voice. Truly speaking, initially,
or inappropriate and excessive.
it can be excessive plus inappropriate use. You know, initially I thought, okay, when we have some kind of voice disorder, it could be we are abusing the voice, but I also read something stating that actually our vocal folds, our vocal cords is quite can bear a lot of abusive behavior. All right. When that kind of disorder happens, that means we might be overdoing it. Okay.
No, I totally understand that.
All right.
Yeah. Thank you very much, Dr. Chia, for your time today. Really appreciate your insights and your pedagogical experience. Even as you say, at some point in time, you had to learn by doing, sometimes by doing it quite inappropriately, but finding out the balance and the equilibrium there.
Yes.
Thank you, Dr. Chia.
My pleasure.
Thank you, everyone, for staying the course of this session. I see that Dr. Chia has got a deluge of questions. Dr. Chia, over to you.
Yeah, I look at the chat box. I noticed quite a few questions. Okay, all right. Okay, what is good fundamentals of singing? What is good standing posture, stand tall? I think just now in that video, some of you already saw. Basically, that in my teaching, I always maybe I just run through the 10 fundamentals. I always start with posture, breathing. Okay, expanding related to the breathing. So you must learn how to lift, expand your rib cage. Then together with that breathing, I often encourage the student to breathe through their nose and the mouth. And when they breathe in, take in the air, always open the mouth slightly and keep the vocal tract constant. Then you have there, we call open throat. Open throat means the entire vocal tract is not constricted during the breathing. And often, no noise is a good breathing. If you hear noise, that means the vocal tract is a bit narrow or tight. So then the other fundamental, lift your soft palate or raise your soft palate. Right, then relax the lips, jaw, and tongue. Easy to say, but not so easy to habitualize, especially the tongue. The tongue can be quite difficult to tame. So we already got to learn how to soften and relax the tongue. It requires some determination. Okay, and now I almost covered 7 or 8 fundamental. Okay, now the next one. In singing, we got to learn how to stabilize the larynx throughout the singing process. From the first note of the song and to the end of the song, you must learn. I'm not saying that when we stabilize, it's always in a static, rigid position, but it should be more or less in a comfortable, suspended position. You know why? When it goes too high, not easy to bring out those high pitches. All right. Of course, when we have to keep the larynx stable, it's not trying to depress the larynx using muscle or like using some singers may practice using the back of the tongue to push it deep, to push it down. And the above fundamental I've said will influence the resonance and the onset. Of course, the onset involve the intrinsic muscle of the larynx. Some singing teacher may not want to sort of manipulate the intrinsic muscle overly. But in my teaching, I may want the student to have some feeling, some sense of control, but not overly control. So when all these are in place, one should hear more balance, resonance in the singing voice. All right. So these are the fundamentals. Just now I mentioned in my the dialogue. Okay. I also noticed my voice giving way when I talk for a long time. Maybe I just definitely we shouldn't overuse our voice. All right. See, I've read something like the average usage of our voice when total up in a day, it should be around 2 hours, right? But you see, for example, I believe many of you here are teachers. See, as teachers, you teach maybe at least 5 or 6 periods per day. Let's say you only teach 30 minutes per period. So if you teach 5 periods, if you speak really every minute, 5 periods, you're always talking for 2.5 hours. That's already beyond your total limit per day. And plus, you are talking to colleagues, talking to maybe before the school, family members, and after school with family members and friends. So actually, you might be using your voice for more than 3-4 hours a day. So in your teaching, you must learn how to devise different activities so that you don't have to talk all the time. Of course, if you feel that your voice is a bit tired after a long day of teaching, you must learn how to preserve your voice. So, for example, after school, you may have to shut up, okay? Don't talk anymore, even if people, but sometimes we can't help like talking on the phone, etc. And in fact, talking on the phone can wear out your voice. You know why? When you don't use the voice in the kind of optimal level, you think you're talking softly, but sometimes talking softly, you might not be engaging the breath to produce that optimal sound. So actually, trying to speak softly or trying to speak timidly actually tires the voice. Okay, so that's my advice for excessive use. If you have no choice but to use your voice in a prolonged manner, so you have to be a bit more observant. Okay. Does it mean I have to go to a teacher to learn how to speak and say? Well, if you really want to be a better singer, of course. But I also have to warn you, I'm not trying to say anything negative here. Not every singing teacher or vocal coach is a good coach or singer. Okay, so you must find the right person. I'm not trying to promote myself here, okay? But I have learned enough to differentiate. Okay, the moment I listen to a voice, I could tell, okay, roughly what's the cost, right? Because I remember years ago when I went on my sabbatical, I attached to I worked under Richard Miller, okay, one of the most eminent singing teacher. He was telling sort of like conference participant, and then I also remember he said to me, see, the most difficult thing a singing teacher or a voice teacher has to do is you must learn how to diagnose the voice. Okay, listen to the voice and then know what to prescribe to help the voice. Even back then, that was the year 2000 when I worked under him. I dare not claim I know how to really diagnose. But of course, throughout the years, I slowly thought I picked up some kind of skill and how to listen to the voice. All right. So I would say yes, but make sure you go to a reliable teacher. Okay. All right. Sometimes you got to search and find a little bit. Can Dr. Chia demonstrate to us on what he had shared? Okay, I wish I could, but I don't want to turn this care seminar, this session into a voice lesson or singing lesson. Okay, maybe it's other time now. Not today. Okay, actually I demonstrate a little bit already. So we shall put this on hold first. Maybe the camera can film the mirror. The day I have no control over the camera, so I think the camera film me. Why I put 2 cameras? Because mainly I just want to show as a learner, when we have two cameras, we can use the reflection of one mirror. One mirror capture our side view, and then you can see the image in the other mirror. That's how I sometimes I use two mirrors. Okay, I remember when I took some Alexander techniques training, I read about Alexander. He cured his voice, or he developed his Alexander technique and voice by using initially 2 mirrors, then 3 mirrors, even up to 4 mirrors. Of course, that's very extended. But even if you have 1 mirror, if you want to learn how to sing, good to sing in front and speak in front of mirror and actually check your lips, your tongue movement, and see if they are natural or what. Okay? All right. How about that here? There's a noble standing. Maybe I talk a little bit about noble stand. It's very good that if you can discover or develop or try to find a good posture and then practice it every day and make it your second nature, so that you don't have to think about posture when it comes to singing. So it's almost like automatically incorporated into your voice use. So if you are teaching in the classroom, always remind yourself, standing tall. If you cannot remember that the 6 areas of adjustment, don't worry. You just stand very tall, unlock your knees. As simple as that. Okay? Yeah. Onset, this is the how we begin that initial sound. In singing, I'm quite particular about the vocal onset because the vocal onset can influence the subsequent vocal phonation. That means how we sustain, how we continue with the sound line. All right. So it's a very well coordinated breath, sound source interplay. All right. Of course, it also involves you must set your lips, tongue, jaw in the right position for the required vowel, and also resonance balance. Okay. But it can be a bit complex to go through it in a short time we have here. So I would suggest whoever asked this question, you can go to Richard Miller's book, Yen Yen. You can look up the first chapter of Richard Miller's book, The Structure of Singing. Okay, that can be a very good source as a reference. Right? Does this mean you offer? Well, at the moment I won't commit myself because basically, of course, when the COVID is over, at the moment I retire from NIE. Okay, so I do teach a few private students. Okay, if I'm not trying to advertise my service, but if you have my contact, say if you have some vocal matters that you want advice, definitely I'm happy to share my view. Okay. All right. How do I slowly regain my voice? Learn the correct way of voice usage. See, I remember reading the earlier book published by McCloskey, written by McCloskey. In one of the chapters, he said, if someone came to him for voice therapy, if the person refused to practice what he prescribed for the voice, he would inform the person, don't come back. So the person must be open-minded, willing to try some good alternate way of voice production. Okay, actually, many voice therapy exercises are quite similar. Okay, for example, I know the SGH, some of the voice therapies are prescribed like hum, or a lot of humming, all right, to enhance the resonance. But of course, when we listen to that even simple humming sound, we must ensure that, okay, the neck muscles are not tense, are not interfering with the very delicate voice producing muscles. And then we must also listen to the pharyngeal area, those muscles, mainly we use them for swallowing. Those muscles should be uninvolved. And then, of course, the lips, jaw, tongue can be adequately in the right place to produce a kind of balance, resonance, balanced voice production. Okay. So it's possible, according to McCloskey, he said, no voice is uncurable. Say, he believes even some severe voice disorder, if one is willing to patiently go through some of the exercises diligently, one can regain the voice use. All right. Is there any cure besides having the fundamental help to prevent? Of course, I think we got to acquire the good fundamentals in order to make sure the entire instrument is properly aligned. See, in our voice use, sometimes when problems start to creep up, usually it could be certain tension start to develop. And then in our voice, it's quite strange. When certain muscle is not in the right place, so other muscle will come in to sort of help out. Actually, it can be over busily helping each other. And then it becomes, it's like a scaffolding. You take away one important rod, then the whole scaffolding start to become shaky and eventually may collapse. So the voice is the same. So you need alignment of every fundamentals. Okay. So it's good to learn how to acquire those fundamentals. Of course, initially you may need some guidance. All right. But definitely you don't want to use your voice for more than 5 hours. Just now I said the max is about it's not my what do you call that? This 2 hours is not what I'm trying to. Actually, many authors, voice therapists, voice doctor, they publish that daily voice use should all add up totally should be about 2 hours. Okay. Of course, if you know you have to use your voice extensively, so you know how to space out your voice use time. Okay. Right. So am I stretching the time too much? Because it's already 7:15. Okay.
Let's finish the questions,
Okay.
Dr. Chia. While we're
Eugene, do you have anything you want to respond to some of those questions?
No, it looks like they've all been they're all heading towards your clinic now, Dr. Chia.
Yeah.
There's some very interesting questions that have been raised, and I think
I
it's
also read about, is drinking honey help? Well, if you feel that it helps, then you drink. If truly speaking, you see, for example, when we have the kind of cough drops or whatever, if you feel that the voice is a bit hoarse, see, truly speaking, all those medication does not really go to your vocal folds. It goes in through your mouth, oral space, actually go into the pharyngeal space, and then actually whatever you eat, you drink goes into your esophagus, the stomach. It doesn't. But psychologically, if you feel that, that can help you. Do it by all means. Okay. All right. Actually, the best thing is if you feel uncomfortable with your voice, vocal rest, voice rest. Hydrate your body with enough water, adequate water, but don't overdrink also. All right. So after speaking over a prolonged period, the throat might feel tight, and that you may want to learn some good voice production habits. That's what I would advise you. Okay. All right. Okay. I think we have. Yep. I think that's about all.
Thank you very much, Dr. Chia. Thank you for those of you who raised those questions. Quite clearly, here are our supporters. It's quite clear that this is an understated problem. And rather than worry about legislation and medicine and corrective medication or corrective surgery, perhaps some very sensible approaches to caring for the voice, pacing oneself, and understanding some of the basics in which we use the voice might be the very first steps that actually not only prevent but also preempt the way in which we take care of our voice, our bodies, and our livelihoods. I want to thank Dr. Chia so much for this
My
wonderful
pleasure.
opportunity to share with us things that come from a vast level of experience and expertise. I want to thank Chihu, who runs CARE, because for years and years, I've been talking about this, and Chihu has enabled me through CARE to open up this issue that no one talks about, no one wants to talk about, but we now have an opportunity to enable us to say, this is something we have to pay attention to because it is our lives, it affects our lives, and it affects our livelihoods. So thank you, Chihu. And then to the CARE team, thank you so much. There was so much background work that Dr. Chia and I are so grateful for. Zul and Anthea, you made it so seamless. It's almost as if all we needed to do was to use our voice, and then the rest is the rest. You know. Thank you so much, Anthea and Zul. Again, to Melia from the library, because she helped me identify a source in the 18th century which I couldn't get because it was out of print. And she showed me the ways that could be done. Again, I want to thank VPA for supporting CARE in this endeavor, because at the end of the day, we are working with the notions of arts, research, and pedagogy. Thank you, everyone, for being here. Good night. Have a wonderful weekend. Take care.